at ESMO Congress 2024, I presented POLAR trial, an investigator-initiated trial for Pembrolizumab and Olaparib in patients with metastatic pancreas cancer with or without homologous recombination deficiency. Most pancreas cancers are poorly immunogenic, but based on our translational observation in the clinic, we hypothesize that highly select pancreas cancer can be immunogenic, and we think certain patients with homologous recombination deficiency can derive benefit from immune checkpoint blockade. So we demonstrated that precision immunotherapy is feasible, and we were able to prospectively select and enroll patients into this POLAR trial successfully and completed the accrual of a total of 63 patients within 3 years at Memorial Sloan Kettering Cancer Center. So everyone had comprehensive germline and somatic genomic and immune profiling at serial time points, and switching their platinum chemotherapy to non-chemotherapeutic agents combination. So Pembrolizumab and Olaparib, the immunotherapy combination, allowed significant disease control. So disease responses were seen in 35% in core A, and 6-month progression-free survival rate at 62%, and 3-year overall survival rate at the moment was 52%. And they are maturing, and 13 patients of them, really have active treatment still ongoing. What's exciting about this study is that deep comprehensive analysis beyond genomic instability score, neoantigen, tumor-infiltrating lymphocytes are ongoing, and so please stay tuned for more updated reports. And at the same time, this is a non-randomized trial, but SWOG as 2001 is really evaluating this in a randomized fashion. So adding pembrolizumab on top of Olaparib, is it valuable, is being asked in SWOG trial. So